Chair and Secretary to the Government of the Federation, Honorable Ministers, Permanent Secretaries, colleagues, gentlemen of the press. Today I thought to update you a bit on a very topical issue globally on vaccination prospects and what is going on generally. We're all aware that there's been a constant increase in cases, and even in countries that initially thought they had this under control, we're seeing some increase in transmission of COVID-19 in many countries in Europe. In Kenya, they've just extended their curfew to July 27, or they extended their curfew on July 27 and banned the sale of alcohol in restaurants following a steep increase in cases of coronavirus across the country, especially in the capital, Nairobi. The reality is that despite several interventions, that we're still facing a global public health crisis that is unprecedented in our times. And of all the innovations known to medicine, the biggest hope that we have to get this outbreak under control is a vaccine. Vaccine is by far the most important medical intervention, any medical tool known in history. Has prevented more deaths, saved more lives than any other single intervention, be it a medicine, a drug, any type of surgery. Nothing has saved more lives than vaccines. This has been the mainstay of interventions against many infectious diseases from polio to measles, mumps, tetanus, and has led to one of the biggest victories that we know in medicine, the eradication of smallpox, and hopefully soon the eradication of polio. So for COVID-19, there's no doubt that we need a safe, effective vaccine to halt the spread of this virus, and this is really the focus of the scientific community around the world. So where are we now? Normally, vaccine development takes anywhere between 10 to 20 years. But yet we have made incredible progress in the last 6 months. The most recognized vaccine tracker by the London School of Hygiene and Tropical Medicine shows that there are about 226 vaccine candidates right now at different stages of development. So far, preclinical and early data is encouraging. Early data has shown that some of the vaccines that are going through these trials are well tolerated among volunteers, which is the first thing you do. But we still do not know how it works in large populations, how effective it is in large populations. So right now, there are about 5 candidates that are in phase 2 to 3 trials, which is really when you try the vaccines among larger groups of people, up to 30,000 people. The data that we have so far is they're safe, from what we know. The data on efficacy, i.e., do they work or not, the earliest data that we know about will be available by the 4th quarter of this year. Not every country carrying out these trials is as open and transparent with their data, but for those that are, we expect early results in the 4th quarter of this year. So what does this mean for Nigeria? Now, the biggest difference between this outbreak and the Ebola outbreak in 2014 and 15, one of the biggest differences is the emergence of a few significant institutions. One is the Africa Center for Disease Control, that is doing the thinking and intervening on issues relating to health security on a Pan-African basis. The second is something called the Coalition for Epidemic Preparedness Innovations, called CEPI. Both organizations were formed after the Ebola outbreak in recognition that you have to bring countries together to work towards coordinating equitable access for vaccines. Africa CDC is now leading and coordinating our region's involvement in vaccine research, development, manufacturing, clinical trials, and access. And while CEPI is coordinating global research and development of vaccines with an emphasis on equitable access. Access is a very key issue when it comes to vaccines. That a vaccine is developed doesn't necessarily translate that it will be available to those that need it the most. So through a structure called the Accelerator, a mechanism through which CEPI is working with WHO and Gavi to ensure that vaccines are available to countries regardless of their ability to pay. Now, this is obviously work in progress, and we're all working together with Africa CDC, CEPI, and Gavi to ensure that when a vaccine becomes available, that Nigerians can have access to it. What can we do? The process of vaccine research and development is very rigorous, and one that as we work towards access, we also have to start thinking about investing in the science and developing the institutions that we will need into the future. But in the short term, we're working together with other colleagues around the continent through the Africa CDC in a consortium for COVID vaccine trials, clinical trials, to start advocating for some of these trials to be done on the continent with African institutions. To do this, we have to build capacity, gather sufficient data, and include African institutions in these efforts. Secondly, we have to start preparing the Nigerian population for vaccine delivery when it becomes available. Thankfully, we have a great national agency, the National Primary Healthcare Development Agency, with a very strong cold chain infrastructure, many years of experience in distributing vaccines across the country. They will be leading on the distribution and the thinking and the planning for this. But we must not take anti-vaccination campaigns for granted. There's always a small part of the population that resists vaccination for different reasons. So the time to start the risk communications about the benefits of these vaccines potentially is now. So these are emerging issues in the work that we do. As we progress towards the end of the year, the importance of this work will increase. As soon as some vaccines become available, our responsibility collectively in preparing Nigerians for the implementation of vaccination campaigns, in whatever form they will take, will become increasingly important. So it's important that we start thinking about this, engaging with the science, but also remaining a little bit circumspect, because none of these are absolutely guaranteed of success within the timelines I've stated above. But we have to remain optimistic and keep pushing so that we see that when these vaccines become available, we are prepared to deploy them as quickly as possible to our people. In the long term, our country should be more involved with the research and development and, of course, manufacturing. A lot of effort has already been made in this regard, but this is a wake-up call for all of us to do a lot more with the private sector, academia, and all the government institutions with a role to play around this. So we all look forward to emerging stories, emerging news on vaccine developments, engage actively with Africa CDC that is leading our efforts on the continent to ensure that Nigerians have access to these vaccines when they do become available. Thank you very much.